Everyone, welcome back to my channel, and today in this video we are going to study about cytokine-related diseases. Now, one such disease is known as septic shock. The word septic means infection, and infection means we are under attack of pathogens. So that is only the infection in our body, and due to that infection, when our body is under shock, we call it as a septic shock. Now, the infection can enter our body due to cuts, breakage in the cells or tissues, due to cancers also, and due to decrease in blood supply also. So there are multiple reasons why we get infection. And the main organisms that are responsible for infection or sepsis is Staphylococcus aureus, E. coli, Klebsiella pneumonia, Pseudomonas aeruginosa, Enterobacter aerogenes, and Neisseria meningitis. These are common bacteria that are responsible for sepsis. So sepsis means infection caused by bacteria. Now, this infection is not only caused due to any cuts and injury, it also happen in certain cancers and also due to decrease in blood supply. Now, the reason behind this sepsis or what happens when we are under pathogen attack or we got infected. So the underlying molecular mechanism behind that is the overproduction of cytokines. Due to excessive production of cytokines under infection condition because body needs to protect ourselves. Now when body wants to protect ourselves from the pathogens, it starts producing cytokines. But due to infection, our body cannot decide when to stop the production of cytokines. So it starts excessive production of cytokines. Now this excessive production of cytokine will turn problem to ourselves only. So that's how our body will then undergo under shock. Correct? So this is due to overproduction of cytokines. Now what happens when our body overproduces any cytokine? It induces abnormal body temperature, alteration in the respiratory rate, high white blood cell count, capillary leakage, tissue injury, blood clotting, and as well as organ failure. So these are the reasons due to which a person can die if the person is under septic shock. Now, we have some monoclonal antibodies to tumor necrosis factor protected animals from endotoxin-induced shock. So these antibodies, monoclonal antibodies, are used for the protection. Now, there are some injections available. For example, recombinant interleukin-1 receptor antagonist. This we already learned that it helps to stop the excess secretion of interleukin-1. Similarly, we have tumor necrosis factor alpha, which can harm ourselves when produced excessively. But in case of tumor necrosis factor alpha, we cannot completely reverse the situation, but we can provide a little benefit to the patient. Similarly, we have tumor necrosis factor and interleukin-1. It increases rapidly under sepsis. So if we can diagnose it in an early stage, it is beneficial because we can protect the patient. Now, bacterial septic shock due to superantigens. What do we mean by superantigens? Superantigens means these are antigens only, but because of these antigens, our immune system becomes superactive. Then we call it as a superantigens. So a variety of microorganism produces toxins that act as a superantigens. Now, superantigen binds to class 2 MHC molecules, and that's how it activates T cells. The adaptive cells of our body are T cells and B cells. B cells can directly recognize the antigen, whereas T cells can recognize antigens when presented via MHC molecule. So these superantigens, they bind to these MHC molecules only. So when they bind to these MHC molecules, it overactivates T cells. Now, such bacterial superantigens, they are the causative agents of several diseases like bacterial toxic shock and food poisonings. Toxic shock syndrome toxins from Staphylococcus aureus pyrogenic exotoxins from Streptococcus pyogenes, and Mycoplasma arthritis, supernatins. These are the examples of some superantigens produced by these specific microorganisms. And the result of superantigen is excessive production of cytokines, because the name itself, superantigens. These are antigens that makes our immune system super active, or we can say more active. So more active will leads to excessive production of cytokines, and that's how it in turn harms our body. Now, cytokine activity in lymphoid and myeloid cancers, not only during septic shock, but under cancerous condition also, the body produces excessive cytokines. So abnormally high level of interleukin-6 are secreted by cardiac myxoma, that is a benign heart tumor, myeloma and plasmacytoma cells, as well as cervical and bladder cancer cells. So these are the cancer conditions under which our body produces abnormal interleukin-6 molecules. Under myeloma and plastocytoma cells, interleukin-6 appears to operate in an autocrine manner to stimulate the cell proliferation. So as I told you in the last video itself, that cytokines operate in a paracrine or in an autocrine manner. Paracrine means activate nearby cells. Autocrine means activate self cells. So under these two cancerous conditions, interleukin-6, it operates in an autocrine manner. That means the cell that produces cytokine, specifically interleukin-6, will use this interleukin-6 for self-activation, and that's how it proliferates the cell and leads to cancer. So monoclonal antibody against interleukin-6 can help to inhibit the growth of such cells or cancers. Now, these are few more examples like soluble tumor necrosis factor alpha receptor and monoclonal antibodies against TNF alpha have been used to treat rheumatoid arthritis. Recombinant form of interleukin-1RA is used for the treatment of rheumatoid arthritis again. Monoclonal antibody against interleukin-2R are used for the prevention of transplantation rejection reactions. So these are the examples of some clinically approved method to protect or to cure or to provide beneficial effect for the patients suffering from such diseases. So that's all for this video. If you found the video informative, please do like, share and subscribe the channel and hit the bell icon for the next video notification. Till then, stay safe, stay happy.